In this video, we're going to talk about creating a chart protocol that will be related to CMS130 colorectal cancer screening. This is a follow-up video to the summary we have on core objective 6 of meaningful use. If you have not yet watched that video, I'd encourage you to watch it first. It explains why we're doing this and what the requirements are. In that video, we described how to create a chart protocol for breast cancer screening, which is CMS 125. In this one, we're going to see how to create one for colorectal cancer screening 130. This is going to be actually even simpler than the breast cancer screening in that it's not gender specific, it's only age specific. Basically, after I clicked on more info, here's the detail. Percentage of adults 50 to 75 years of age who've had an appropriate screening for colorectal cancer. Again, this is going to be a reminder type protocol, and it's only going to be based on age. So I'm going to come back to Practice Studio. I'm going to go to my chart protocols, so P, setup, chart setup, and chart protocols. And I'm going to create a new protocol by saying add protocol item. Okay, we'll go ahead and call this CMS 130 so it's clear what this is related to. The description is for your own internal use. The notification message can be the same if you'd like. It's basically the summary message that will come up when it's a hit. And then the details are the instructions to give yourself whenever this is true for the patient. Okay. The last important piece is we're going to set the execution type to automatic. All 5 that you create for the meaningful use objective need to be automatic in order to meet the requirements of the measure. In this case, we're not even going to have a gender-specific criteria. It's only going to be age-related. So we're going to come down here to the add under screening ages and frequency. It's going to be a between range. I believe it was 50 and 75 years. Let's look at that. It is 50 and 75 years of age. So we're going to say between 50 and 75 years. If you wish to make the protocol recurring, so after you dismiss it the first time, it comes back up in a certain amount of years, days, weeks, months, etc., you can. I'm going to choose not to in this case and save it. So this is about as simple as you can have it on a chart protocol. It only measures on age. It's not recurring, only happens the one time, and that's it. So we're going to go ahead and hit save. And let's see it work. So we're going to go to provider, medical records, choose a patient. We'll choose the male patient this time within the age range you can see. So when we go to start posting, we have a health protocol. If we look at it, there's our colorectal cancer screening. If we look at our details, those are the details we entered, and that's what the measure is asking you to do, to have these type of screenings active, at least 5, for the reporting period.